if you want to learn three different approaches to treat three different barbell athletes, this episode is perfect for you. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to learn three different approaches to treat three different barbell athletes, this episode is perfect for you. Before I go on to the podcast, what is new? What's better? My kids are doing fantastic. Zach is in flag football, and we are having our first game this weekend, and excited about that. Alex is chipping away at her gymnastics and doing a lot more activities on the bar and balance beam. So I'm really excited about that. Jacob is communicating more and more, and boy, when he talks, we better listen. That's what I'm learning with him. Other than that, what is new? Really excited to looking forward to some time away and enjoying time with the fam. Always love to do that a couple times a year, long weekends, whatever it is. So I'm excited about that. Fitness is consistent. For those of you who are in the San Diego area, come join us at our anniversary party at Sports Performance. It's been 8 years in business and 8 years of fun with the community. So we're hosting an event October 1st in San Diego at our Chula Vista location. If you guys are local, we'll come say hi. Those of you remote, you'll have to join us another time. And what else is going on with the Chris Garcia Academy? We've got the barbell course coming up October 15th and 16th. We have the webinar for barbell athletes on the 11th, which is Tuesday from 5 to 7 p.m. That's all the things that are happening in the background. All right. What is happening with this podcast? All right. So why are we talking about barbell athletes and the different approaches? What's interesting is, uh, for a big portion of probably the last decade, I've spent so much time working with barbell athletes. And what I mean by those barbell athletes, and some who might not be familiar with the terminology might be different, but I'm talking about CrossFitters, I'm talking about powerlifters, I'm talking about Olympic weightlifters, anybody who touches a barbell. And I love barbell athletes. I love working with them. It's really straightforward to work with them once you know the background of like the basic 3 to 5 movements of whatever it is that they do. Once you learn that, and you learn the variations, it's so basic. I shouldn't say simple. It's really, really basic. And I have spent so much time, one, under a barbell, but two, working with them that working with them is really straightforward. And I want other PTs to have that same experience and maybe not feel so hesitant or reserved or conservative with them, because that's been the feedback that I've gotten from barbell athletes. They wish that PTs would push them a little bit more, obviously with under safe guidelines. But I think that there's a couple different reasons why PTs maybe might treat them a little bit more conservatively than others. Is maybe that it's an awareness of the sport, awareness of what you can push and pull, and then the timing of how you work with these individuals. So that's why I wanted to share across the span with people who are all over the world wanting to improve their skill set working with barbell athletes. So that's why I'm doing this. And literally leading up to my barbell course, I keep getting questions from listeners and people who find me on Instagram or social media, and then I ask like, okay, specifics about barbell movements or how I manage them. And so I just wanted to share across what some of those questions are and how to do that. So let's start this off. So before before we go into like how to treat them and everything else, let me describe the three different types of barbell athletes. Okay. So number one is an Olympic lifter, and the term for these individuals is Olympic weightlifting, Olympic lifting. They are also in a community, they might refer to themselves as weightlifters. And if you're not familiar with this community, you might say, well, like, isn't a weightlifter like a bodybuilder or somebody goes to the gym? That's 100% true. Like that's weight training, and these are all semantics. But if you want to know how to speak to them and use a little bit of their lingo, maybe you heard my last podcast on how to work with a CrossFitter or whatever it is, you kind of have to know their lingo and you have to understand what their terminology is. So number one is it's an Olympic lifter, Olympic weightlifter, or a weightlifter. That's kind of how they refer to themselves, and that's what they're known as. So an Olympic lifter is somebody that you've seen that's I don't even know if it's still an Olympic sport. I know there was a big debate, and I think that they might have had some updates. Anyways, it was or is an Olympic sport still, and this is typically what you've seen, like where they move a large load really quickly, and they perform two main movements, and that's the clean and jerk and the snatch. Those are the weightlifters, and their main thing is like, how can I get this large amount of mass to the desired location as fast as possible? So that is Olympic lifting. And then we have power lifters. Power lifters are individuals who have to lift the heaviest possible weight on a barbell in and this was not necessarily about speed. It's about how can you move the most mass. So in Olympic weightlifting, speed is a big component of that. Powerlifting, speed can be, but ultimately it's can you lift the weight from A to B. So these individuals aren't working so much on speed, they're working on mass, total weight. How can I move this thing as high as possible, and the largest amount of load as possible? So you have powerlifters and you have Olympic weightlifters. And in between there, you also have a community of CrossFit, and this might be like functional training, any variation of that. And why am I including that? Because CrossFitters will do variations of powerlifting or this different types of strength that you might see in Olympic lifters, but also powerlifters. So you get both variations. So now, if you really put CrossFit in between the two, it might be kind of a happy medium where they're working on a little bit on speed, they're working on a little bit on load, but then they're also doing the variations of all different types of movements, box jumps, lunges, rings, muscle ups. It also has gymnastics in there. So somewhere in between lies this kind of happy medium of all these different types of sports. So when you look at these things, you also have to consider, okay, well, now you have three different types of athletes. What's the difference? And then how do I treat them differently? So that's what I wanted to go into before. Okay, so those are the three barbell athletes. Before I go into how to treat them differently, let's talk about four different types of strength. And this is very important because I've covered it in my strength and conditioning summit. I've covered it across a couple different podcast episodes, and I think it's important. It's a foundational thing for physical therapists to understand. And how do you label strength and conditioning? What types of different strength do people require? So let's go through that. Okay. Number one is max strength. Max or absolute strength, that's synonymous. So max strength or absolute strength. So this is typically you have four different types of strength, and max strength is really what you probably think of when you think about strength and conditioning. How do I get somebody as strong as possible? Now, this is irrespective of the person's weight. So somebody who weighs 400 pounds and is strong is probably going to be able to pick up more weight in any given like type over somebody who weighs maybe 100 pounds. So just because of their size alone, they're probably going to have a difference in their max or absolute strength. So this is how much of a load can you pick up in general, irrespective of how close that is to your body weight, whatever it is. It doesn't matter. Can you lift 600 pounds? Can you lift 800 pounds? Can you lift 1,000 pounds? Max strength has a big component or a big relationship to powerlifting, because in powerlifting, you're just trying to move this mass from point A to point B. So powerlifters have to have a large amount of max strength. So when we talk about the next one, which is explosive strength is now how fast can I move that load? So explosive strength is typically Olympic weightlifting, where I now have to pick up this bar from a deadlift position and bring it to an overhead position, like a snatch or a clean and jerk. I'm trying to move the most amount of mass, but as quickly as possible to get to the desired location. So explosive strength is literally how fast can I move the largest amount of mass in the quickest amount of time possible. So there's a time component in there. Now, in powerlifting, speed is not as big of a factor as it is in CrossFit, or excuse me, in Olympic weightlifting. Now, the irony of all this is that when you look at power force over time, we just said that powerlifting is not so much focused on the speed at which the bar moves. It is a component, but it doesn't determine whether that lift was successful. So powerlifting is always a very interesting label when we're not talking about speed as a larger factor when compared to Olympic weightlifting. So Olympic weightlifting has a bigger focus in explosive strength. Now, we have max strength, which is more related to powerlifting. We have explosive strength, which is more related to Olympic lifting. And then we have relative strength. Relative strength is relative to your body weight. How much are you able to move your own body weight? So, for instance, this might be somebody who has high relative strength would be somebody who is in gymnastics. When somebody who is in like maybe figure skating, somebody's in cheerleading, somebody is in specific sports relative to their own body weight. Now, can somebody have good relative strength and max strength? Yes, but typically an individual who has a lot of relative strength may or may not have good max strength. Now, you have to think about yourself. Like as you start hearing these terms, you're like, well, wow, I actually can do a lot of pull-ups. I can do a lot of push-ups. I can do ring dips. I can do, muscle ups. That's good relative strength. You can move your body mass in space using your own like strength. But maybe you might not be super strong. You might not have a big deadlift or a big squat or a big bench press. So your max strength is low. And now you might think, okay, well, I can move really fast with a lot of load. That's high explosive strength. Is it possible to have all 4 different types of strength? You're probably going to have 2 areas where you're really strong and the other 2 where you're not so strong. That's typically what you'll find. The last one we have is strength endurance. This is somebody who can repeat pushing or pulling or moving a load over time using the same with repetitive movement and being able to sustain that same workload over time. So, for instance, somebody has good strength endurance is like, say, for instance, you're going to push a sled, and you have to push a sled from like 0 to 50 feet, and you have a certain amount of time to move that load. Can you repeat that for 10 intervals and be able to do that? So somebody who has like the good strength endurance, maybe a cyclist, they can repeat like intervals and have a really consistent time. Somebody who runs 800-meter, repeats or whatever it is. So you have people who have really good strength endurance. And if you ask me, Chris, okay, what are your strengths out of all those profiles? Like, what's your profile? I'd say I don't have the greatest max strength. I'm not the strongest person. I don't have explosive strength. I'm not the strongest. And you have to understand, if you don't have good max strength, like a good base, you don't have really good explosive strength. Typically, you need really good max strength to be explosive. And that's really what happens with weightlifters, Olympic weightlifters. I would say my 2 strengths are the other 2 options. More relative strength, so I can move my body weight in space pretty well. Number 2 is that I have strength endurance, so I'm able to maintain the same work output over repeated intervals and have consistent performance. So those are the 4 profiles of different types of strength that you have. Now, how does this compare to the 3 different barbell athletes? Well, you kind of have to know what the sport is. You have to know what types of strengths are involved. And then that goes into, well, now how do I treat them? How do I work with these individuals? Because if you just treat them like every other athlete, like they're a soccer athlete or whatever it is, you're not going to have the same outcome. You're not going to have the best possible outcome, and you're going to lose a lot of these patients and athletes, I promise you. So what's so different about them? Okay, so we just described the 3 different types of barbell athletes, the 4 different types of strength. All right, let's profile these individuals. So an Olympic lifter has high explosive strength with a foundation in max strength. There's 2 primary lifts, the clean and jerk and the snatch. What type of range of motion demands do these people need? These people need end range motion. So in a snatch, it's basically a full squat with their arms overhead underneath a maximal load. So they need end range shoulder flexion. They need end range hip flexion. They need full knee flexion, full ankle dorsiflexion, and they need to be in upright position when they're in overhead squat. So they need the full range of motion of all of their main joints, ankles, knees, hips, shoulders. They need full range in an extended or end range position. Now, that's very important on how you're going to manage these individuals. Now, what type of training do they do? They're heavy in volume, meaning they are going to be doing anywhere from 3 to 5 repetitions in their strength cycles. That's typically where they're going to be, anywhere from 1 to 5. 5 is when maybe they're in, off season, they're starting to start up with training, and they might build up to 1 to 3 reps as they get closer to competition. Intensity wise, they will reach very high intensities. Typically, right before a meet, you might hit 93 to 95% of their 1 rep max within those movements. Now, in off season, that's going to change a little bit, that they're going to have lower intensity, but in general, they have higher volume and higher intensity. So you have to understand these individuals might have in their off season higher volume, lower intensity, and those might change and intersect as they start to go into their peak competition. And as they enter their full competition or in competition mode, their range of motions will need to be addressed way before their comps. So this puts it in a profile of like, well, what if they don't have the range of motion as they come into competition, or when do I address it? We'll talk about that. But ultimately, you have to understand the profile of this individual. They do explosive strength, max strength is the foundation. They do clean and jerk and the snatch. They need end range of motion. They work on both heavy volume, heavy intensity. Now, when you're working with these individuals, what are your main options to help them overcome pain or continue training? That's what you realize with Olympic lifters. These individuals don't want to stop training. They just want to keep going. I promise you, they love it. So what are your options as a physical therapist? How do you make modifications for these individuals? Typically, you got to know what the 2 main lifts are, the clean and jerk and the snatch. So for you, you need to know the variations of the main lifts. If you've never taken a course or you've never worked with a barbell athlete who does Olympic lifting, you need to learn the fundamentals. So this podcast doesn't have enough hours to be able to explain them all, and that's why if you're really interested in this, you need to take my Management of the Barbell Athlete. Like, you have to. It's a great foundational course to be able to set you up for success. But ultimately, all right, there's variations of the lifts. So let me give you a really quick rundown. When you do a clean is get the bar from the ground and bring it to your shoulders, and you have to keep it in a straight line. The variations that are going to help you the most are working. If they ever get injured, let me make this easy for you. If they ever get injured, whether it's their back, their knees, whatever it is, instead of starting from the ground, start them from the reverse. Start them from their hips. So you start the bar, instead of picking up from the ground, you lighten the load and bring them to a hang position. So a hang position is they hold onto the bar in a very normal grip, and they start from their hips. And the reason for that is because if they have back problems, they probably are not going to want to hinge all the way down to the ground. So you reverse it and you put the load higher to their center of mass, higher to their hips, so they don't have to bend down as far. So you do a high hang position. Like a hang position is now from a knee, and then a full position is going to be from the ground. So high hang is from the hips, a hang position is from a knee, and a pulling from the ground or unrestricted is going to be is in a traditional deadlift position. So if they ever get hurt, the easiest thing you can do, start from a hang position and start there. Now, if their lower body's injured, then you're going to start with blocking the depth to go all the way down. So they could only go, to 90 degrees. They can only go to a box. They can only go to the ground. What I'm saying here is you need to know that what your options are. Most Olympic lifters, you know what they'll hate? When the person says, "We'll stop lifting." And the reason you say that as a clinician, and I say this respectfully, the only time a clinician says this is because they don't know the sport. Or there is something broken or torn, and they need x-rays or an MRI to clear it. That's the only time that you say this. Otherwise, you just don't know the sport. Why else would you tell somebody to stop? It's because you don't know the modifications and different options that you have to be able to support this person so they can continue exercising. So there's your two easy options. Start from a hang position or control your depth. So the start position or the end position, those are your two options. All right. Now when we talk about, let's go into a power lifter. A power lifter typically focuses on the max strength or the absolute strength that we talked about. This is like how much load can I move without respect to speed. So they really focus on max strength. So a lot of these individuals are going to be doing the same volume of training as an Olympic lifter. They're going to be doing ones, threes, and fives in terms of reps. They might go higher in the off season, but ultimately on their main lifts, the absolute main lifts or one or two main lifts, they're going to be doing their traditional 1, 3s, and 5s, and sometimes up to 8 with the accessory work. So with these individuals, they're going heavy. They have three main lifts, which is going to be your bench press, it's going to be your squat, and it's going to be your deadlift. Those are your three main lifts, and they will do those every day, all day. Typically, they'll train 3 to 5 days a week, depending on where they are at. In the off season, obviously, they're going to do higher volume with less load, and as they go into competition, you get the inverse, where now they're dropping the amount of reps and they're increasing their intensity. So, what is your option with, or what are your options with these individuals? Now, very similarly to Olympic lifters, your variations are like based on the height. So what I mean by that is if they're having back pain, knee pain, you're going to have to control how far down they go into a squat. That's really what you're going to do. You can play with the load, but if they're close to a competition, they don't like to change the load. So you might have to change the variation of how deep they're going. So if they have back pain, knee pain, hip pain, you got to control the depth at which they go down. Now, from a deadlift, if they have pain with that, you're going to have to start with the opposite, which is don't start them on the ground and maybe start them from a hang position, or they're only going to have to drop down into like knee depth position. Ultimately, you got to simplify this. If they're hurt, they can't start from the start position, or they can't start from a traditional deadlift position. They might have to start from the hips. So you can put the bar on maybe a cage or a rack from a high position. They can grab the bar and go down into a partial range. You're going to have to control the total range that at which they're actually competing or training in. Most people think like, well, why can't I just reduce the weight? That's true. That's 100% true. But when they're close to competition, or they have something coming up where they can't change the load, or that's a big component, you have to have other options as a physical therapist. And I would say early in my career, that's probably what I did. I would always just, okay, how about let's just decrease the load. Also, okay, great. But what else can I do for these individuals? Change the depth at which they're doing. And the same goes for bench press. If they're having shoulder issues, they might not be able to come all the way down. So change that. So ultimately, change the depth, change the actual range the available range that they can train through. So you might, closer to competition, you change the intensity, and closer to off season, you can change the load or the total volume, meaning how many total days are they training, how many total reps or sets. Don't always go for the load. Like that's everybody's instinct. That's the one thing I could tell you. Now, we talked about Olympic lifters, we talked about power lifters, and in both of those cases, you're going to change the depth and the available range that you can. And depending if they're close to competition, you change the intensity. If they're off season, you can change the volume. Now, what about CrossFitters? The individuals are kind of in between. They are doing both variations, max strength. They're doing explosive strength. Now, the element that we're adding in with CrossFitters is you're going to do the same movements as the Olympic lifters, clean and jerk, and the snatch. And they're also going to do variations of the same movements as a power lifter, bench press, deadlift, and squat. So they're doing all 5 movements, and they're now adding in the other 2 strength, which is strength endurance and relative strength. So with relative strength, they're now adding in gymnastics. So they're going to be doing muscle ups, a lot more pull ups, a lot more push ups, and they're going to add in strength endurance. So that might be workouts on the bike or on a rower or with a sled or any version of workouts where they're repeating the same cycles over time, trying to maintain the same work capacity. So, what do you do with these individuals? Now, the great news for physical therapists who's never worked with CrossFitters, like your instinct is like the same thing. Well, let's just not do it. That's not the answer. So, we already said from Olympic lifters and power lifters, you can change the available range and the depth. Great, we know that. But the easier part now that you have with CrossFitters is that you have so many more options to now modify because in Olympic weightlifting you have two main movements, and then in powerlifting you have three main movements. In CrossFit you have I don't even know 50, 70, 200 different movements. It becomes a little easier because now you can modify. It's a double-edged sword. If you don't know CrossFit, you can also ruin it by saying, "Oh yeah, you just no deadlifting today," or whatever it is. But they'll find 30 other movements where they're like, "Well, what about picking up a dumbbell from the ground, single arm, and raising it up overhead?" Well, that's still a deadlift. Okay, so what about a rower? Ooh, that's almost very similar to a deadlift. So no rowing. So you kind of have to know where your limits are. And what you do is you tell them the total depth that they're blocked at, and they can work around that. So if you listen to my last podcast, I'm a big fan of using a green, yellow, and red light system, meaning my red lights are the things you cannot do. You cannot pick up the ground, you cannot pick up a weight from the ground. Okay, that helps me a lot. Now I have to understand where am I going to pick it up from? Well, from the waist height. So you have to modify everything else. The load has to start at the waist. Oh, okay, got it. What are my green lights? You can do anything under 75% of your total intensity and load. Okay, now that helps me out. What are my yellow lights? You can do dumbbells, no barbells, and you can only train 4 days a week. Okay, so you got to give them some guidelines here. So CrossFit has so much variation that it makes it difficult to give them some bumpers or yellow lights. And so you kind of have to understand what you can modify. So what I'm saying here is the good news is Olympic lifters have two main movements, power lifters have three, CrossFitters have all four different types of strength, and you get to modify all of them. The benefit to you as a physical therapist is if you're saying just don't exercise or train CrossFit, it's because you don't know. There's no reason why you would do that. Now, if they have a disc herniation, a fresh disc herniation, obviously they're going to cut back. But ultimately, you're trying to figure out how can I modify it? And I think that um, if you love what you do and you love what you do for people and the people you serve, you're passionate about this, so you want to learn more. It's like that's why you're listening to this podcast because you're like, well, I want to learn how to work with these people better. I don't want to see, I don't want to be that like no PT. Don't be the no PT, like meaning no, don't do that. No, don't do that. Stop exercising. Stop. Like that sounds like a physician who knows nothing about exercise. The easy answer is no, just wait 6 weeks. It'll all feel better. No athlete wants to do that. So for you to avoid being the no PT, you got to know what you can modify. So on these individuals, easy guideline, as it comes closer to competition, try to not touch intensity. In the off season, you can lower the intensity, meaning the perceived intensity. So that can be RPE, it can be the relative percent relative to their 1 rep max. So it can be load, total load, it can be intensity, their RPE or their heart rate. Now, as it gets closer to competition, that's the thing that they need to keep the highest. You're going to not modify that. In off season, that's what you can modify. So as you continue to find the balance in your personal practice, working with CrossFitters will be easier to modify, but that requires that you learn more about the movements. If you understand that they work with 4 different types of profiles of strength, max strength, which helps dictate explosive strength, they work on relative strength and strength endurance. They will need all 4 of those things. So think about this. If you think about physical therapists, what type of strength do we typically work with? We probably work on strength endurance and relative strength. Think about that. When have you worked with somebody to get somebody close to their 3 to 5 rep max? Rarely, unless you work in a strength conditioning like system or company. What about explosive strength? When have you gotten them to work on speed, basically intensity or speed or tempo? Maybe like vertical height or hops or jumps. That's probably what you've worked on in the past. But in order to get them to the maximum explosive strength, you probably had to build a very good base of max or absolute strength. That's where we typically don't come in. We work with getting them started with explosive strength or finalizing them to get ready back to sport, but we've never enhanced it with a good max strength profile. We'll typically work with somebody's strength endurance. Like, can they repeat the same thing over time within a given given time or workload? That's typically what we work with. And relative strength, can they get to being able to do a push-up or a pull-up or whatever it is? I think we have a good idea of how to work on those systems. Now it's helping an athlete put together. Now, the difficulty with putting it together for every single sport is that maybe you haven't done them or work with these individuals. And that's where you have to understand what the sport requires. And that's why I wanted to cover this underneath one podcast. There are 3 different types of barbell athletes that you'll typically see. Now, I'm not discounting bodybuilders, but I'm just talking about what are the 3 different types of barbell athletes that you may not see on a regular basis. And they all vary with how quickly they move a barbell in space and the amount of load that goes on them. So 3 different types of barbell athletes: the Olympic lifter, the power lifter, and the CrossFit athlete. The different approach is the modifications that you're going to have with these individuals. So the first thing you have to look at, what is the available range of motion that they need? Olympic lifters need the full range of motion at all depth, all joints. CrossFitters need all of the range of motion at any given step. So if you ask me who requires the most range of motion, probably the CrossFitter, because they're moving through space all the time underneath loads. The Olympic lifter needs end range shoulder flexion and max dorsiflexion, hip flexion, knee flexion. And the athlete who needs the least amount of range of motion or available range of motion is the power lifter, because they don't ever have to get into max shoulder flexion. They really don't. They do have to get into full squat range of motion, and they do have to be able to pick up a barbell from the ground. But if you ask who needs the most amount of available range, typically the CrossFitter, the Olympic lifter, and the power lifter in that order. In terms of volume, the Olympic lifters and the power lifters will have typically the largest amount of volume with the highest loads and the lower reps. The Olympic lifter and the power lifter will probably have higher intensities in terms of how quickly they move that barbell through space. And the CrossFitter just has intensity with perceived intensity, so like work output. So they're always typically around 70-80% of like how fast they can go. They're like sprinting, and then they'll move into like shoulder press or bench press or being able to do push-ups. So they're working about 70-80% on a regular basis. The downside is there's no real seasons. And if you get, your community member who's a CrossFitter, they really don't have blocks of time where they're working on like a specific program. Not every CrossFit gym has a strength and conditioning coach that works on developing a program, meaning for like 3 months, we're going to work on absolute strength. And then these next 3 months, we're going to work on explosive strength. And then these 3 months, we're going to work on relative strength. And then these 3 months, we're going to work on strength endurance. It's all kind of tied together. So if the CrossFitter is in a gym that's typically going for functional fitness, they typically will have a mixed bag of programming, and all you're trying to do is keep them in there. So you have to know what you can modify. And if they don't have a competition coming up, then start to work on decreasing their intensity just a touch, and then start to decrease their volume of training. That's my advice to you. If you have an Olympic lifter who's working with somebody, they have a very detailed approach on how they're going to get closer to competition, so that makes it a little easier for you. And the same with the power lifter. The power lifter usually has a target. They have a competition happening in 2 to 3 months or whatever that is. So you have to know what their profile is. how much range of motion do they need? What's the volume? What's their focus, volume or intensity? And that's going to be tell you, are they close to competition? You need intensity. If they are off season, they're typically working on volume. And if you need to make modifications, you work on the opposite. So if they're working on volume, decrease the intensity. If they're closer to competition, they're working on intensity, decrease the volume. So that makes it easier for you to make adjustments. And the CrossFitter is, they're just training all year long. Decrease the intensity just a touch, decrease the volume, and then decrease the days that they train. And that's an easy, that'd be my easy solution. And after working with, probably over the last decade, working with barbell athletes, that's probably how I simplify working with them. And I start looking at the range of motion. I look at where their competition is, and I work backwards. If they have a competition in 3 months, and I know how much I can work through, they're typically seeing me as they make the transition into higher intensity and getting training, increasing their intensity as they get closer to competition. And that's when they start getting the aches and pains. But most importantly, if you're asking Chris, okay, how do I get them out of pain? Then that's fine. That's the easy part that we can do. The hardest part is building something after they get them out of pain, after they complete the competition, building something, a framework, so that they don't have to come back and see you only when they're hurt. You can build a stronger foundation after their comp and develop a strength and conditioning cycle, or maybe they work with a strength coach and work with that strength coach and figure out what their biggest deficits are, and work long term. How do you avoid having them get injured right before comp? The strength coach would love you, the athlete would love you, you get stronger in your skill set. So wherever you are listening to this podcast, just know you have to know the 3 different prep profiles. You have to approach it with what's the available range that they need. Are they focusing on volume? Are they focusing on intensity? And then what are the modifications or variations that you can work with this individual? And if you take that approach, it'll help you simplify how to work with these individuals instead of being the no PT, because I don't want you to be the no PT. I used to do that. I mean, it's only because I was like new to my practice, and I didn't know what to do. I was just literally trying to put a bag of tools and just hit everybody with it. And then I had to realize, like, wow, these athletes are very, very different. I have to figure out what their sport is. I have to know when in season they are. I have to be able to work backwards. I have to learn strength conditioning. So don't be overwhelmed. If you're like, man, I only know pieces of this podcast. I only know like a little bit of these things he's talking about. Just that's totally normal with that. If you're thinking like that, good for you. And that's very normal. Like we've all been there. I'm still there. I'm going to continue to find new challenges. And for you, wherever you are in your practice, just understand, as long as you continue progressing, keep seeking out these like pearls, these tools in that toolbox, because ultimately you're not just trying to learn like technical skill, you're trying to learn a framework. And if you ask like what I love doing is teaching frameworks. I love teaching, like, give me any case, and if you can put it in this framework, it'll help you solve it just a little cleaner. You don't have to depend on like the back adjustment or the same tape job that you do or the same exercise. The the things that you do on the treatment table are so small relative to setting the framework from the very beginning and doing it properly and setting a roadmap. That to me is the biggest thing that you can do to change your clinical practice. And that's really probably my jam. That's what I love doing the most. So I'll be covering that at the Management of the Barbell Athlete course. If that's interested to you, go for it. If not, join me on my next one. But so it is, my upcoming course is on October 15th and 16th in San Diego. There's a hybrid option if you want to do virtual. Great, good for you. That is Saturday, Sunday, and we're going over the main lifts for all the barbell athletes. And even if you've never touched a barbell, this course is going to be perfect for you because it'll help you get through all the variations from a hang position, a high hang position, from the ground. We'll go in over various types of like the snatch and the clean and jerk and all those things. So if you never touched a barbell, this is for you. If you've touched a barbell many times over, this is also for you. So, and people have asked, is there a webinar for it? Yes, October 11th. It's a Tuesday from 5 to 7 p.m. 2022. And already I'm getting the question, what courses after that? So the next course after the Management of the Barbell Athlete is the Sports PT Kickstarter. This is for anybody who's like, I've been interested in sports PT. I need that next step. What recommendations do you have? I'll be literally mapping out I think it's 8 weeks. 8 weeks you're spending 8 weeks with me. One time a week, you're meeting with me for 1 to 2 hours, and it's all virtual. So we're going over what's the roadmap for a sports PT. What would you do if you were just starting? If you're a new grad, if you're established, if you are in school, your third year, second year, this is perfect for you. If should I do a residency? What should I not do? If I don't want to do residency or I can't do residency, what's the next step for me? That's what the Kickstarter is. So I'll be doing that. That starts in January, and that is an 8-week course for the first 8 weeks of the year. And that is exciting. That is going to be my next course. So wherever you are and wherever you're going to join me, I'm excited to be part of the journey with you. But yeah, so there you have it. 3 different approaches for the 3 different types of barbell athletes. I hope you enjoyed the podcast. I will see you guys at the barbell course. If not, I will see you guys on the next episode. Take care.